Well, welcome. Tonight, we're going to talk about an institution in Milford, a group of incredible people, an incredible facility that's been taking care of groups of our incredible people, our mothers, our fathers, our grandmothers, for many, many years. A lot of people don't know what we have available in Milford, especially to take care of, pretty soon, us when we get to a certain age. So let's start with an introduction.
Yes, hi, my name is Michael Isabella, and I'm the new administrator of Countryside Healthcare of Milford.
Now, if you said countryside, I don't think anybody would know, or very few would know what that means.
Okay, formerly the Geriatric Authority of Milford.
And we remember your predecessor coming on when he said he was going to change the name.
Mm-hmm.
You want to explain why the name was changed?
Actually, I'm not that sure why it was changed.
I remember
it possibly has to do with the road that we were
No, it was actually,
off.
he explained it was the image, because unfortunately, with what you're reimbursed, you can't make enough money or an equitable range of money to take care of the actual costs. So the rehab people, like, you know, when people have their knees redone, and was profitable. But we kept being told that people didn't want to be assigned to the Geriatric Authority, because I'm young. I don't have to go there. So it was funny, because when he brought it up, it was all about just marketing. That all of a sudden, well, I'm going to Countryside. That sounds appealing. I don't have to be sent to the Geriatric Authority.
It does. It sounds more like a country club than a rehab facility.
And even the rehab, I mean, you know, when you think about what's available there, I've gone to too many places where when my mom had her knees redone, as you'd walk in, it was depressing. It was dark and sterile, and I don't get that feeling at Countryside.
And you wouldn't. It's been totally refurbished over the last several years. The latest addition about 2 years ago was a memory care unit. It's a full-service dementia care unit, mostly just private and semi-private rooms, very beautifully appointed, great staff. They do a great job with the residents who live there. It's probably one of the best facilities I've ever seen, and I've been an administrator now for over 33 years, so I was really impressed with it when I first walked through the door, and when the offer was made to me, I readily accepted it.
What brought you to Milford, of all the places you've been?
Well, I had worked in Milford in the past at another facility on the other side of town, and Countryside was always a #1 competitor, and we could never quite stack up. So when the opportunity presented itself, I was contacted by a recruiter, and initially my answer was, well, no, I'm not looking for anything right now, because I was very happy where I was. And it was so I went in for an initial interview, and I felt it went well, and they contacted me right away within a few days and asked me if I would come in for a second meeting and to meet the board of directors. So I also went in for that appointment, and I felt that also went very well. And then I waited. Unfortunately, they didn't make their decision for another 4 months.
Oh, really?
And from what I was told, I guess there had been a total of 49 applicants, and
Wow.
I was the last one standing. So
That's what matters. Now, when you talk about Countryside being #1, what makes a facility long care? I mean, is it long-term care? Is that the correct?
well, we have 3 different wings in the facility. We have one wing that specializes in short-term rehab. We do a lot of total hip and knee replacements, and a lot of other types of rehab just for muscle weakness and other things like that. We have a long-term care unit that's 51 beds, and then we have a 28-bed memory care unit specializing with people with Alzheimer's or different types of dementia.
So the difference between the long-term care and the memory is just that. I mean, people are in there for a long term, but they don't have the
Correct.
memory issues?
Correct.
What's the difference in caring for those people?
Generally with people with dementia, there's different ways to, approach them, give them time to do things, at their own pace. Keep them safe, keep them occupied during the day, or if they are of that point where they tend to, pace and wander, they can do so in a safe environment because it is a secured unit, as well as it has an internal courtyard where people can go out and walk around as they would like.
Oh, how wonderful.
And get some sunshine.
Because I remember, my sainted mother, who's always here in the studio, has lived with us for 31 years. And it was only recently, 2-3 years ago, that she had a stroke and dementia set in. Now, she's almost 94 and healthy, but we have to be so careful because we turn our back and she'll wander up the stairs.
That's very common with that group of residents. A lot of times they have, decreased safety awareness. So,
Well, but that's the scary part, Michael, because it's not as much her wandering up the stairs. It's that she's lost her balance. She'll carry her bag, and that seems to be like Linus in a security blanket, that wherever she goes, she carries her bag. And if that gets out of whack, she can lose her balance. So, for us, we're very, very worried that if we're not watching her every minute of the day, she could hurt herself.
that is always a possibility. Even in the best facilities around the country, there's never any guarantee that somebody won't have, a mishap during the day, and that's unfortunate because unless you're literally under arm's length away, that's never a guarantee. So, most of the staff, they're all trained on, what to look for and try to help prevent those things from happening. But in actuality, there's no guarantee.
Well, you can never get 100%,
anywhere.
but the facility, as I understand, is designed to minimize.
That's correct.
So you don't have lots of stairwells going up and down and places where people can wander and get hurt.
Nope. In fact, we're one story, so there are no stairs at all, which is a good thing because my previous building was 5 stories, and that was a little bit tough between elevators and staircases that did present a danger. We were all on 1 story, which is nice. The building is spread out quite a bit, so for those residents who like to walk, and we do have multiple people who will spend the better part of their day just, walking around that unit, and it's, the way to describe it, it's kind of shaped like a baseball field, where you have like a V, and then you have more of a rounded out field area, we'll say. And then from either side of this circular corridor, you can enter an internal courtyard also, where if you want to go out and get some sun or fresh air, and there's 2 doors in and out. Pretty much everything in that area is visible from the various hallways. It has a couple of dining areas, which is nice. One if people can eat a little more independently, and then one if people need a little more assistance with their meals.
The meals, I've been amazed, because you always think of, okay, I'm going to the rehab facility, and do I have to eat dinner there? I want to be with my mother, because when she had her knees done, we just couldn't leave her alone. Poor mom's always used to having family, so my daughters would get out of school and scoot right over there at 2:30, 3 o'clock. Then I'd get home at 5:30 and stay till 8. So we had to eat, and now all of a sudden we found out the food was pretty good.
And it is. It is. Most of the residents enjoy the food. We usually put out more for short-term as opposed to like long-term residents. We do send out a survey as soon as they go home to ask them about all aspects of care and life in the facility. So how was the housekeeping? How was maintenance? How was admissions? How was the food and dietary, laundry and housekeeping? Because what we generally do, depending upon the feedback that we get, we adjust the way we do business in order to meet people's demands.
Yeah, I mean, there's so many things that we take for granted. Laundry, maintenance, that when she went first to have her knee done, the facility she went to did not have a television working. Well, that was a problem, and especially, my mom enjoys watching RTP, the Portuguese TV.
Mm-hmm.
So we had to go get cable and sort of doctor up a television for her to watch. But you'd never think about it until we got there, and she's going to be there 24/7 for I think it was a couple weeks. Having something as silly as watching a Portuguese channel meant everything to her.
It is. A lot of the residents do like to watch TV. The only thing with that, well, there's also a lot of activities that are offered. We have a lot of outside entertainers come in. I think over the course of the month we have at least 6 outside entertainers that will come in. We have small bands. We have solo singers or players. We've had animal petting zoos come in where people can actually hold small animals, a rabbit, a goat, pot-bellied pig, little chicks and stuff like that. And I think some reptiles too, for those who want to dare.
That is so pleasant to hear, because one of the things that I noticed is it seemed like too many people were just being warehoused, waiting for the big bus ride north. You'd walk in, you'd see these rows of wheelchairs, and people just sitting there for hours and hours, and kind of felt depressing.
Yeah, well, it depends upon what you have for staff, that, the people who are involved. Nowadays, unfortunately, in the state of Massachusetts ranks 46th in the country on the lowest Medicaid reimbursements. So a lot of facilities are pressed for money, and therefore maybe they can't afford to get in as many entertainers or to have as many staff people on board. Countryside, that was one of the things that really impressed me when I initially went. I've never seen a building with so many staff in it. Most buildings run at around maybe 3.5 hours per person per day, or maybe a little bit more, whereas Countryside runs at about 4.8 hours of staff
Wow.
per person per day.
It's pretty significant.
And that's just for the nursing department.
Now, one of the things I don't think most people understand, when it was called Milford Geriatric, they thought it was owned and run by the town.
Mm-hmm.
I don't know if they see Countryside, they still think about it, but I think a lot of people wonder, what is the relationship with the town of Milford?
Well, my understanding, in fact, I just got the information to clarify that for myself, because when I first got there, I was under that impression also. The reality is, back in 1988, up until then, it was owned by the town. But in 1988, it became the Geriatric Authority of Milford. Basically, the term authority, it's considered a quasi-state agency, but we make our own rules. We're governed by our own board of directors. There is some interaction, a good amount of interaction with us and various offices at the town, but basically we're on our own when it comes to managing.
But yet, your long-term debt is carried on the town books.
Well, there are, I think, loans that were given to us either through bond offerings for which we financed some of the renovations that the building went through over the past 7 or 8 years. So in that regard, yes.
I remember because I asked the question, why are we bonding money for the Geriatric Authority? And one of your board members actually told me, because we'll get a better rate as a town than they can get on their own.
Mm-hmm.
So it made perfect sense. Because at the end of the day, if something were to happen, and God bless you for running a tight ship and being able to make ends meet, and we'll talk a little bit about, I don't know how that's possible with the Medicaid rates, but if the facility was going down, how could the town not rally to keep it going? And you've got our mothers, our fathers, our grandmothers and grandfathers, our uncles, our aunts. How can anybody vote? It's like voting against the senior center.
Well, it's good to know that they have our backs in that regard because today the standalone healthcare facility is going by the wayside. Just the economies of scale, it's getting harder and harder to make ends meet. And we have that, all the time at our facility, just due to the amount of, mass health recipients that are there. That comprises about 60% of our population. So it's, the majority of our funding comes through that. So if they are inadequate, then we have to make that up with the other groups of payers, which would be Medicare and a lot of HMOs from the area that pay better,
For the
and
rehab.
some private pay people, yes.
So now when you think about it, how many patients do you have?
We have a
Countryside?
capacity of 109.
So 109, and how many staff?
Well, we do have a lot of part-time people, so it makes the numbers larger, but I think the last payroll we committed about 183 staff members.
That ratio is still pretty impressive, even if they're part-time in there.
It is. It's one of the highest I've ever seen anywhere.
Because, I'm trying to think. Everything I read about Medicaid says if you had to exist on Medicaid solely, you couldn't make it.
Probably not. You would eventually go out of business if you're 100% Medicaid, or you would be able to offer very little in the way of amenities. You wouldn't be able to do any major repairs or upgrades in your facility, and you'd be running with bare bones staffing.
Yeah, I mean, you think about it, it's our families that are in there. What is it? Do you have a feeling for the percentage of Milford families at Countryside?
I would say 85 to 90% are all from Milford.
Are all from Milford. So, you think about it, if Countryside didn't exist, first of all, it wouldn't be 2 miles from home to go see your family. Second of all, probably wouldn't have the environment, the atmosphere and all the activities.
Correct.
So, when you say it's nice that the town has your back, it's nice that you have our back. Because when it comes to, I know a good friend that I grew up with, went to high school with, just had the trauma of having to put her mother, because she couldn't take care of herself anymore. And I know a lot of us are getting to that point where you do the best you can, but eventually I can't be self-centered. If I can't take care of my mom in a safe way. It's bad enough turning my daughter over to the college, but I knew I'd get her back. It was only 4 years, I'll get her back, I'll see her, Turning over a loved one to somebody else to take care of 24/7 when they can't take care of themselves, it's got to be the most scary. I mean, I know it. I think about it and I shiver.
It's a very difficult decision for many people because they wrestle with just that fact. They have to resolve themselves to the fact that there comes a point where the amount of care that's required becomes prohibitive for somebody to live, work, and take care of somebody in their own home. And that's usually, it's always gets to the point where it's almost a crisis before people give in and say, I can't do it anymore, and then they start looking for a facility that they would like. Most people from the history that I've known will go out and visit, maybe 2 or 3, maybe 4. A lot of people don't do a lot of homework when they place someone. It's just with the hopes they come with the expectation the care will be good. They never come expecting, gee, the care is going to be bad. It's up to the individual, and my history with the industry, most of the time the number one determining factor where people will place somebody is proximity to home.
Where's it? I mean, if you weren't in Milford,
Mm-hmm.
where's the next long care facility?
Okay, after Milford, I know of another in Medway.
Okay, that's not too bad.
It's not too far down the road. Used to be family owned, but was recently sold maybe a year or two ago. I'm not sure.
All of a sudden
I think
you're-
there's some in Upton.
Yeah, all of a sudden you're
but
20
not
minutes
too
to
many.
half an hour each
Mhm.
way.
Could be. And it's good because I myself live in Worcester, and I myself have a relative who's in a facility but down in Rhode Island. And I'm her power of attorney as well as her healthcare proxy. So for me to visit, it's a 100-mile round trip.
You're talking a 3+ hour expedition.
Yes,
By the time you leave your
every
home.
time I go down.
So, I can imagine that in today's day and age, with 2 parents working, and if you have, what do they call us, the sandwich
Generation.
Yes, the sandwich generation, where you're taking care of your parents and your children.
Correct, yes.
I can't remember when I had 3 or 4 hours every other day or so that I sat around and said, I don't have anything to do. So it's got to be uber tough.
It is, but when that day comes, then you sit there thinking, what should I do with it? So, but you have to learn how to plan. Basically, a lot of times, take care of all my household chores and things like that,
Yeah,
and
but I'm
then
just thinking how
head down for a visit.
When Mom went in for rehab, when she had her knees redone, at 2:30, the kids were out of school and down there. They sat with Grandma till 5-ish, till I could get there. And then at 8 o'clock, they told us, go home. But, I had a 3-mile drive. It wasn't very hard at all. We could go down every day. If I had to do 3 hours, I don't know that all of us could do that.
It makes it hard because it pretty much eliminates a during the week while I'm working visit, because to do that, by the time I would leave work and get
You get
down
there,
there
they're telling you,
and back,
get
because
out.
then it's rush hour, so of course traffic's going to move much slower. Go in for maybe a half an hour and then jump back in the car and come back.
So now, somebody makes the decision, or one of their family helps them make the decision that they're going for long-term care. A lot of people hear it's $13,000 a month, $10,000 to $13,000 a month.
Mm-hmm.
How do people afford it?
Well, most of them don't. Most of them are being supported by Mass Health. Depending upon if you're there long-term, a small amount of people have long-term care insurance, but most of that doesn't cover everything. And then there's another small percentage, maybe 15%, that pays privately, and it is very expensive for them. And unfortunately, if their funds run out, then they transition over to Mass Health.
So what ends up happening is, if I'm going there, I'm going to use up all my assets.
Pretty much, unless you have a substantial amount of assets.
Well, at $100-some thousand a year, it'd have to be pretty substantial to keep that maintained.
It would.
Eventually, then when I run out, then I go to Mass Health.
Mass Health, yes.
And what does it take to get on Mass Health?
They have various qualifications, financial qualifiers. You can't have more than $2,000 in your own assets. Pretty much you can't own, property anymore. No savings, stocks, bonds, or anything like that of any value. If you do, generally they
They'll
ask,
use that up first.
Yes, you have to liquidate that, and once
Okay.
you hit the $2,000 limit, then you can apply.
So it doesn't seem unfair that, if I'm sitting on $100,000 in my bank account, that the state asks me to use that up first before they pick up the tab.
Because if you're going to be there for 3, 4, 5 years, the state's picking up a big piece of that. But when you look at it the opposite way, like we might have a rate that's say the best rate on Medicaid might be $250, $260 a day. So if I asked you to go to a hotel, check in, get all 3 of your meals, get laundry and housekeeping done.
$150, $160 just for the room. I'm on my own.
Right, so now you have to add in, you're going to eat 3 meals a day, you're going to get to go to activities, you're going to get to see entertainment free of charge, you're going to get your laundry washed, dried, folded, and put away in your drawers every day. A housekeeper's going to come in and wash your floor, wash your bathroom, and everything like that once a day. You're going to have outside entertainers come in. You're going to have, a nurse there 24/7.
I was going to say, but more important than anything is I'm going to have somebody watching me because I'm with you.
Correct.
Because I can't live, if I could live in a hotel room on my own, make my own food, I could live in a home.
Correct. But I'm just saying, money-wise,
Well, no.
if you had to go out there and get all those things individually, it would cost many times that amount.
It wouldn't be $300 a day, even though 300 seems ridiculously high, because you turn around and say, okay, so that's $8,000, $9,000 a month, or. But wait a minute, I don't get a nurse.
And there wouldn't be any nursing care. There wouldn't be any nursing assistance in that hotel.
And I'm in a hotel that's not designed and run to protect me from doing silly things. When you think of some of the people with memory issues, they just don't remember they can't climb stairs. It's my mother. 3 times she's fallen and 3 times she's had to go to Milford Hospital. And you feel terrible, but it's like, well, she was just here, she was walking to the bathroom, and for some reason she diverted. She started going up the stairs and fell. Can't blame her, she didn't even think about it.
No, well, a lot of times as people progress in dementia, a lot of times they lose their safety awareness. A lot of times they lose spatial boundary perceptions. In other words, a lot of times depending upon what the decor and wherever you're living is, if there's a dark floor, to a lot of people with dementia, that appears to be a large hole. So a lot of times you'll see people step around it, or if there's like a dark stripe of tile that goes across your floor,
Or a dark
they'll
carpet.
step over it, because to them, for depth perception, it appears to be a hole. A lot of other things that happen is they tend to get tunnel vision at a certain point, so it's like looking through a much smaller lens than you would if you're walking and seeing
So
on your own.
who's covered under Medicare versus Medicaid?
Okay. The easiest way to describe it is Medicare is for people who are generally at 65 plus. You've worked, you've paid into the system, although you can be a dependent of a worker. But you can also be 10 years old, be disabled for more than a couple years, and now you can also go on Medicare at a very young age due to permanent disability. Medicaid, on the other hand, is strictly for people who can't afford to pay.
It's Medicare with no assets.
Pretty much, yes. Yes.
And then Your predecessor, Barry, once told me that what really helps is getting people through rehab, because that's through private insurance and private pay, that they tend to pay a lot more and you can offset some of the Medicaid losses.
That is correct. That is correct. If it wasn't for basically our rehab department, we would have a very tough time making ends meet.
And there it's not the minimum that Medicaid pays. They're actually paying you at least to cover your costs and maybe a little more.
That's correct. That's correct. There's usually a better profit margin with that. But there's also other things where if you're on Mass Health, they pay for a lot of the ancillary services. They pay for your pharmacy, lab, x-ray, and those things. They give you strictly room and board, which is your room for the day, your food, your laundry, your housekeeping, and
Yeah, but I remember
activities.
when my mother was on rehab, she still had the Blue Cross and the prescription from General Motors. So she didn't really need the Blue Cross to pay for her prescription because that was taken care of already. So from that end, I can see it's not a big issue. You know, I'm 65, I'm on Medicare. Okay.
Well, generally, with Medicare, if you've worked all your life, you automatically get Part A when you hit 65. But you have an option to purchase the Part B, which takes care of physicians and some other ancillaries. But then there's also what they call like a Medigap insurance. A lot of people are under the assumption Medicare, if you use it at a skilled nursing facility, that it pays for everything. Well, it does. It's all inclusive for the first 20 days. They pay 100%.
20 days?
20 days. Now, from day 21 through day 100, there's a co-insurance payment that's due, and that's approximately $175 a day. So even if you have Medicare, if you go beyond day 20, somebody has to pay that $175. So if you have a Medigap plan, that will pick up that $175. If you don't, it comes out of your own pocket.
And that assumes you have assets.
Correct.
If you don't have assets, then you go from Medicare to Medicaid.
Right, and then Medicaid would take care of that.
And then there's a Part D for prescriptions.
It's very complicated.
Well, I remember when my father retired from General Motors, now that'd be about 35, 37 years ago, somewhere in that range. He had an option of choosing his entire pension or 75 or 60% of his pension. And if he chose the lesser amount, it was in effect his entire life and my mother's entire life. God bless him for picking that.
That was a smart decision.
Well, but back then in healthcare, he was going to get $450 whole pension, and by doing the latter choice, he only got $300. But it came with something that nobody cared about, which was healthcare. Now all of a sudden, you're talking 31 years since he passed on, and my mother has still been taken care of, prescriptions and medical. And they make her do Medicare, and then above that, whatever's there, they pay.
If you did the math on that, you would be astounded.
Well, that's why General Motors, when they were going bankrupt, they said the issue they had was that it was costing them almost $7,000 a car to maintain the retirees and their families.
That's correct.
And I can believe it because, when I think about Mom had intestinal cancer, ended up costing us, I think, over $2,000. Now you think about the surgery, the treatments, the post-surgical care, they picked it all up. Someone's paying for that, and it's paid for by the people buying General Motors cars.
That's very fortunate because generally, even a short stay in the hospital, and most hospital stays are maybe 3-5 days now, but if you get somebody who stays in for like
14 days,
2-3 weeks, you're looking at $65,000 to $100,000.
Yes.
Easily.
And you sit there and say, okay, My folks, my mom worked at Draper, Dad worked at General Motors, hard-working, salt of the earth, you know, Milford people. Where are they going to come up with 65 or 100 grand when they're retired?
Well, either they have it in savings, or it gets to the point where they have to look at if they have a house.
Sell their
potentially have
assets.
to sell their assets.
Now, you mentioned 85 or 80+% of the residents are Milfordians. How about the staff? How many Milford-related people do you think you have on staff, or percentage-wise?
I'd say a very high, I'm not totally familiar with it as of yet, but if I had to put a guesstimate on it, I'd probably say about 75% all
That
come from
alone
the town.
Is something to make people comfortable. I mean, when I first came in to talk to you, and all of a sudden I see a big smile of Mother Peacock, you know, here's somebody that I coached, her son, her daughters were always, and you look around, you see all these people that are Milford people. Makes you at least made me a lot more comfortable to know that, okay, so we kind of took care of her kids when we were doing soccer. Who would I trust more? I know these people, you know, we spent years together, and it's probably not fair to the non-Milford staff, because they probably would take care of them just as well.
Mm-hmm.
But seeing that big smiling Beth face takes your tension down, because it's like, okay, I can trust her.
I was always amazed with that also, that many of the staff, they all know each other from either high school or various things that happen around town. And you know, a lot of them know the residents because they were their former neighbors or relatives themselves. We get a lot of staff members who have family who are there.
And that's why I say, you know, if something ever happened, I mean, I bet you if you looked at town meeting members, out of the 200 some, you'd have a large percentage that have family or ties to family at Countryside.
Yes, that's correct.
You know, so there's never a guarantee that they would stand up and vote. But how could you ask somebody on town meeting floor, would you vote to throw your mother out of Countryside and maybe she'll go to Worcester? Throw out of this environment of Milford people. I know we're very, you know, as I always said, 28,000 of us know that Milford's the center of the universe. The other 6 billion have to be educated. But you can't ask me to be logical when it comes down to my mother, my father, you know, family members. I can be logical on a lot of things, but you just can't. How could I vote to evict my mother or your mother, you know, people I grew up with?
Well, things, you know, it gets, every year it becomes more difficult to, you know, get paid for what we do. Every year, in fact, I just had to do it a couple times over the last few days, but every time that recently the governor vetoed about $7.5 million of funds that were supposed to be being spread to some of the nursing facilities around the state. And, you know, I realize he's got a tough job too, and he had to make some cutbacks, but he was looking to cut back, you know, $7.5 million spread across the state. And so through our local association called Mass Senior Care, they encourage us to call our representatives to, you know, override the veto, which they were successful in overriding the veto yesterday.
You know, and again, you think about it, in abstract, it's easy to say we can't afford it. This is all we can pay. But then you say, that's my mother. And I have no doubt that whatever they cut, you won't let her go without her meds. You won't let her go without, you know, Mother Peacock watching over her. But maybe that entertainer can't come in. So
That's
all of a
correct.
sudden today, there's nobody there to make their life a little brighter. And I think people forget that such a trivial amount of money, I mean, $40 billion, $7 million.
Yeah, it's not even a percentage.
You know,
So-
I mean, the legislature's increased pay was more than that. You know, what are the biggest challenges you think you're going to be facing going forward?
Well, right now there seems to be a statewide and nationwide shortage of nursing assistants. And it tends to run in cycles. About every 10 years, we go through one of these cycles. And it becomes harder to attract the staff that you need. And then, of course, they're always not the best paid people. We'd always like to give more, but we're always constrained by what Mass Health gives us. So when we try to recruit people, if there's another facility down the road who pay another 50 cents or $1 an hour, a lot of people will flock to the other facility just because, they're at that.
$1 an hour is $2,000 a year.
It is. So, and with people on the lower end of the wage scale, that's a significant amount of money, and they have to consider themselves and their families, and it causes a lot of
Think about it
upheaval.
when you came out of school, and especially now, where so many of the kids are coming out with big loans. $2,000 a year can make a big difference for them.
Sure, it's a few loan payments.
It's $200 a month. It's quite a bit. So getting skill, and it's funny because Phil Ciramacoli, who runs Tri-County on the physician side, he came on and he said his biggest challenge is recruiting primary care physicians. So sort of the first level, just like you're saying, your first level, that's the hardest positions to fill.
It is one of the reasons for that with the physicians. Most of them, they all go to school for 15 to 20 years. The debt that they rack up is astronomical. It's not unusual to see $500,000 in medical school debt. Some of them will become what they call hospitalists, meaning the hospital actually hires them, and sometimes as part of the deal they will absorb some of that student loan. Or sometimes there's some government forgiveness if they work in like a high poverty area where they can't attract physicians.
They're already starting 5-6 years behind the rest of us who started working.
Oh, yeah, even more so.
I mean, I'm
because
amazed.
They have high school to go through. There's 12 years of school. They have 4 years of undergrad. Then they have 4 years of usually medical school.
You get your medical
and
school,
then
your
they have
internship, your
and
residency.
and then if you specialize, it might be another couple of years tacked on after that.
So you're sitting there saying 6 years after I started earning money, they're coming out, and they're coming out with $400,000, $500,000 worth of debt.
Right, and then on top of that, if they would like to start their own practice,
Oh, God bless them.
now they have to go out, they have to rent an office, they have to have office staff, they generally have at least 1 or 2 nurses who run the rooms, make the appointments, they need scheduling people, they need somebody to do, like at least 1 clerk.
Even before they opened the door, I remember one of the kids, one of the men I graduated with, went on to med school. And sure enough, 6-7 years later, he comes out as an ophthalmic surgeon. He said, "You don't get it. You've been earning money for 6 years. Right now, I got 400-some thousand worth of debt. I want to set up my own practice." So he went out and bought a little house, turned it into an office. That was another 400. Then he had to outfit it.
Correct.
He said, "I'm 1.2 million in debt. I haven't opened my door."
Then the other biggest thing that they have to, do is malpractice insurance.
Wow.
Now, depending upon what your specialty is, if you go into some high-risk specialties, say the biggest one is usually OBGYN, it's not unusual for them to have a $400,000 a year malpractice insurance. So add that to all those other things you just mentioned,
And
and
now you
you
know why
can't operate
parts of the
as
country can't even get obstetricians.
as a sole practitioner. You can't do it anymore.
And I mean, you think about it, I think Uncle Phil at Tri-County has 95% of the primary care physicians now working for him in this area. There's got to be 2 or 3 that aren't. I've yet to find them because of the same thing. They carrying a big enough burden to set up their own, and now with electronic medical records and everything, wow.
Yes, because it's gotten worse. Electronic medical records do not save time. That was a fallacy that, we can probably save time if we put everything online. Instead, now you have to have one person inputting all of that data, and now we have overload of data. There's nobody out there who can actually sit down and look at it all.
Now, how do you coordinate with, okay, if my mom, my dad are there, they have their physicians.
Mm-hmm.
How does that work? Because they have to get to the physicians.
Generally, once you come to a skilled nursing facility, you have to select a physician willing to come and see you at the facility. So a lot of times,
So they still make house calls?
Well, no, they do. They come to their house if they're at the facility. But for a lot of those physicians, there is an economy of scale with that. Now, if they're running their office, I don't know how many people they might be able to see in one day, because they usually see people in 15-minute segments. So if you multiply 4
Yeah,
times 8, they might
13.7
see
minutes
like
per patient.
32, they might see 32, 35 people in a day. On the other hand, if you have a lot of residents in one particular nursing facility, you might be able to see, well, more than that if you need to, because they're right there.
I hadn't thought about that.
You
So
just have to walk down the hall to the various rooms. And
if I'm making a house call to Countryside, I'm not going there to see Joe Smith. I'm scheduling it to see a bunch of people.
yes. Usually, most of the physicians will see multiple people. Usually, always the number one physician is usually a medical director, who tends to see the bulk of the residents. And then there are some doctors who follow fewer people, but it might be because they did have a community link, or they just happen to get lucky and their doctor does come to this particular facility. But a lot of physicians that go to the hospital don't like going to a nursing home, because generally what they have to do is leave their practice, drive to wherever the facility is, and that's unbillable time. They lose all that time in travel.
Oh, those 13.7-minute patient visits.
Yes. Well,
If they lose 3 or 4 during the day, they can't make it up.
It's reality. When I used to run another facility in town, it was on the opposite side of town from the hospital. And I could not get any of the docs who went to the hospital most of the time to come, because it would take them almost 20
Now, is the
minutes
rate
to a
the
half an hour.
same?
Yes.
Okay, now that makes no sense at all. If you're coming to me, that's got to be a lot more efficient than me coming to you. But I get paid the same?
Okay, I'm not entirely sure whether it is the
Yeah.
same if you go to the office, but...
But you're not getting paid for travel time, and
Oh, no.
so unless you make up and see 20 people in a day, or 40 people in a day versus 32, I can see why a physician would say, wait a minute, I want to be a nice person. But
I mean, sometimes, if they come in, it might just be a chart check. They don't necessarily have to go and see the patient directly. In other words, if they go in and the doctor asks the nurse, well, how about this patient here? Anything happening? And they say, well, yeah, he has a low-grade fever, and this lab.
so they can make up a couple of...
Right, they can look at like laboratory results and
Okay.
things like that, and do
Because
a
I remember a couple
diagnosis.
of the primary care physicians that came on the show saying, I would love to open my practice, but if I took all Medicare patients, I couldn't pay my bills. Not Medicare, Medicaid.
Medicaid, yes.
He said, we could fill our practice with Medicaid patients, but then I couldn't treat anybody because I'd have no money to do anything.
That's fairly accurate, yes.
So what other challenges do you see? I mean, I think of Countryside. I don't think of a lot of beds open with nobody wanting to get in.
Correct. We have a very long waiting list for people trying to get into the long-term care section.
Well, that's got to be a very positive statement, because if we didn't like you, you know, you think about it, I mean, if you have a waiting list, then somehow people sort of like what you're offering.
That's correct. I'm proud to say we tend to be the #1 facility in town.
So now, when I make that decision that I'm going there, one of my family members is going there, what do I do? I mean,
Well, the first thing that would happen, you would come in and fill out an application. We get some demographic information and diagnoses, medications, and things like that. And then it depends on where your family member is. If they're out at the hospital, we get a lot of information back and forth from the hospital when they're looking to place people if they need post-acute care. If it's somebody who's coming directly from the community, then we send out one of our nurse managers to go out and what we call...
yeah, Mother Peacock makes house calls.
Yes, she does.
I was amazed.
Yes, she does. But anyway, she would come out to the person's home and do an assessment of that person, of what the needs are, what the medication needs are. And then if we feel we can take care of that person, then we can make an offer. And then when a bed becomes available, give them a call.
So it all starts, I mean, you're going through, I won't say traumatic, but the decision cannot be a pleasant one. You know, to give you my mother, my father, my aunt, whatever, a family member, that has got to have my agita up, whatever the scale is, over the top.
Well, most of the time, that's what it comes down to. Most people do not want to make that decision, or they want to hold off as long as possible. But the thing is, nobody wakes up in the morning and says, gee, I can't wait to go live in a skilled nursing facility. But when the time comes when you need to, it's comforting to know that there's some out there that
what do I
have your
look
confidence.
for? If you've got a tainted view because you're educated on this, but when you have somebody who's totally ignorant, and I'm going in, first of all, I walk into Countryside, I see it open, I saw people outside relaxing. I mean, that made me feel good to begin with. I walk in the building, it's clean, it's, I don't know how to describe it, welcoming, it's airy.
Well, basically what I always tell people when they're going shopping for a facility, you can always get a lot of information, online. The government has various websites you can go to that give you a rating as to, how those facilities function, and it's usually on, what they call quality indicators. And then the other thing I usually tell people is go in with your 5 senses. When you walk in the door, what does it look like? What does it feel like? Do you see good interaction between the staff and the residents? Is it cheerful, or do you just see people sitting, in a chair or by themselves? What does it smell like? What does it feel like? Because when you walk in the door, there should be almost a palpable atmosphere when you walk in that door.
Yeah, smiling Mother Peacock went a long way.
Of getting the feel of, if this is what it's like when I walk through the door, it's a good indication that's going to be what it's going to be like, when you come back later.
And then you said you should go see multiple facilities.
You should, just to make yourself, feel confident that you're making, the right decision. You can go in with, a list of questions you want to ask, and again, using your own 5 senses when you walk in the door. I mean, if the place is dingy, the carpet's threadbare, it still might be a good place, but it might not appear that way. Because when people walk in the door of most facilities, they're looking, with their eyes, and they want to see something that's pleasant looking. On the other hand, you don't necessarily pass over one's facilities that aren't shiny and new, because the care might still be great, just that the physical plant might
But
not be.
all being equal, if I think about putting a family member where they're now going to live 24/7, except hopefully I go there a lot and steal them, right? Putting them in a dark, dingy place, I don't know that I really would accept your premise that I'd be comfortable.
Okay, let me rephrase that. I'm not saying it would have to be a dark and dingy
No,
place.
no, but just
But in other words, if you go in a place and the paint's perfect, the wallpaper, the carpet's brand new, yes. But good surroundings don't necessarily mean
right.
good
But I mean, that's
care.
one check. When you look at your 5,
Correct.
that's one check. So if both places have 4 out of 4, and the 5th one is aesthetics, boy, I like the one like Countryside where I walk in and it's open and it's airy and it's pleasant. I'm still going to really worry about the first ones, which are, will I get good care, all of that. How long does it usually take for a wait when somebody wants to get in?
Depends on the circumstances.
Well, the kind.
If you're on a short-term rehab unit, there's not much of a wait at all. That turns over daily. As quick as they come in, 11 days, 2 weeks later, they're going back out the door. If they're like a fractured hip or a knee replacement or something like that, especially if they're there with a managed care company, the expectation is that they want them
want you out of there quick.
in and out
Rehabbed
in
and out.
like 11 or 12 days. You can get them to stay longer if you say there's a need, but you have to prove that that need exists. For people on long-term care, we have, unfortunately, very little turnover on that unit, so there is a waiting list. And I've heard up to maybe a year sometimes of people waiting.
Well, thank you for taking care of our families. And to our 6 loyal viewers, I'll say I hope you never have to go to Countryside. I hope your family never needs to grow old and need extra assistance. But it's really comforting. I mean, I've been in the facility, and I've seen the people. The board members tend to be Milford people.
They are. Yes.
You sit there and say, okay, so the management, the people there, I mean, I feel comfortable that, you've got board members who know Milford, who care about Milford people, making the strategic decisions to take care of our families. It starts with a phone call or a visit to Countryside. That would be the first step in becoming educated. I can tell you that it is probably one of the hardest decisions for an old man like me to have to go there and talk about them taking care of my family, because my family has taken care of me my whole life, and you can't look at it as a failure. You have to look at what's best for your mom, your dad, or other family members, because sometimes you just can't do it in a safe way. And you just got to get over the emotion of, why do I need somebody else to take care of my loved one? And sometimes that's a really hard decision. But feel comfortable that we have great asset here in Milford. Go there, learn. So tonight, I'll say as always, may God bless. May tomorrow be a better night than tonight. Thank you to our 6 loyal viewers for joining us.
Too long since I've been home.